Hi, this is Stephanie Egler, and I'm going to talk through this PowerPoint concerning stress and adaptation, chapter 42. This is an important chapter just because, as we all know, we all feel stress at one time or another in our life. With stress being a part of everyday life, it's easy to see that if we have an additional health problem, such as illness or injury, how that can increase the effects that stress play on our lives. So we will go through some terminology and kind of discuss patient care. So I skipped over slide 2 without any audio, but slide 2 says stress. What does it mean? Your book gives the definition of stress as being um, a condition in which the human system responds to changes in its normal balanced state. Stress can result from a change in one's internal or external environment that is perceived as a challenge, a threat, or a danger. So, stress is unique to every person, and we are always having encounters with stress, and it's constant and it's dynamic, um, and it's a major component in health and illness. How we react to stress is based on that person's cultural, family, genetic inheritance, and life experiences. Um, but again, the key factor is um, with this is um, any change to one's normal balanced state. So, if we've added pressures, such as many of you students are trying to work jobs, you have families at home, and now we've added school, studying, exams to that. So we've changed what was once kind of a balanced life or a balanced state, and we've added some stress to what's going on at home. And that's just a really good example of how to apply the definition of stress with this chapter. If you think about it, it's kind of constant and dynamic, it's always changing. And it does affect you overall, physically, emotionally, intellectually, socially, and spiritually. And it can be positive or negative in how it affects somebody. So, the last slide I talked about stress. And again, it's just that condition in which the human system responds to changes in its normal balanced state. And we kind of said stress. There are major sources for stress your book talks about. A lot of them arise from interpersonal relationships and performance demands rather than actual physical threats. And that's probably very true of most of you. It's more of the perceived challenges that you have coming up that may be affecting your stress level. It might be those interpersonal relationships at home that are affecting your stress level. So, as we think about that and that definition for stress, your book goes on to talk about stressors. So, a stressor is anything that is perceived as challenging, threatening, or demanding that triggers that stress response. So, these are the triggers for our stress. For some of you, it may be that you have an upcoming exam, and that might be a trigger that sends your body into a stress response. Your book talks about you can have internal stressors, which could be an illness, some type of hormonal change or fear, and then it goes on to talk about external, loud noises, cold temperature. Those can all be triggers for stress, and those are what we consider a stressor. Your book continues to classify stressors. It talks about physiologic stressors and psychosocial stressors. When we think about physiologic stressors, they have both a specific effect and a general effect. The specific effect is an alteration of normal body structure or function. But then the general effect is that stress response that we talked about a few slides ago. So, some examples your book gives is chemical agents, drugs or poisons, um, physical agents, heat, cold, trauma, infectious agents, viruses, bacteria, nutritional imbalances, hypoxia. We talk about when we get, let's say, the common cold or the flu and one of those viruses, we immediately have that alteration of body function. We start to feel bad. Maybe we have a headache, nasal congestion. It's affecting our body function. But then we also, it triggers that general effect of just our stress response as well. Psychosocial stressors, the slide here says there's an infinite number and variety, and that is true. We have a lot of psychosocial stressors which become so much a part of our lives that we often just overlook them. Some of those might be the environment, interpersonal relationships, or our life events that can lead to a stress response. They're within the book, and I actually have this box wrong in this slide, but it's actually box 42-1. It gives some examples. And when we think about these examples, they can be actual, real, or they can just be perceived threats. Some of those in this book that, in this table or this box that's listed here, talk about accidents which cause stress for the victim, the person who caused the accident, and the families. Stressful or traumatic experiences of family members. But then also, it gives an example of fear of aggression or mutilation, such as muggings, rape, shootings, and terrorism. So it can just be, that's a good example of a perceived threat rather than a real threat. And the person's responses are continuous, and they include individualized coping mechanisms for responding to the anxiety and the guilt and the fear, and maybe even the frustration and loss we have with psychosocial stressors. But this slide is basically kind of how to differentiate how the stressors the types of stressors there can be on a person. So when a person has in a threatening or otherwise stressful situation, we usually have an immediate response occur. And the responses that often occur are involuntary, and we call these our coping responses. So this next slide talks about adaptation. And the definition your textbook gives for adaptation is the change that takes place as a result of the response to a stressor. So adaptation is to some degree an ongoing process as a person is striving to maintain their balance. Adaptation is necessarily, necessary for normal growth and development. The ability to tolerate changing situations and the ability to respond to physical and emotional stressors, we must be able to adapt to those. So it is necessary for a healthy life, and it is an ongoing process. As you can see, this book or this chapter has a lot of just terminology in the beginning of it. So this next slide, we're going to discuss homeostasis. And as we know, our bodies are always interacting with constantly changing environments, including our external environment that surrounds us, and then also our internal environment that includes the mechanisms that regulate our body function. To maintain health, our body's internal environment must remain in a balanced state. And so we have to use a lot of various physiologic mechanisms within the body to respond to internal changes to maintain that relative consistency or balanced state. And this process, when we're trying to respond and to maintain that balanced state, is called homeostasis. And there's two kinds. There's physiologic homeostasis and psychological homeostasis. In the next few slides, we're going to discuss those. So moving on to physiologic homeostasis. Your book gives the definition of this as being the autonomic nervous system and the endocrine system, primarily controlling homeostatic mechanisms. And basically, the mechanisms are self regulated, they're very coordinated, and they occur without conscious thought. And they defend against the change to the body's internal environment. They, simpler terms, they really just act like they're self regulating, they act like a thermostat. A lot of us, have thermostats in our homes that run our furnaces. So you can think of it as that, kind of turning off and on when it's needed. Your book goes on to discuss the term allostasis, and this term was basically used or coined to describe the process of achieving stability or homeostasis through the physiologic or behavioral change. The cumulative negative effects of these physical responses to prolonged environment and psychosocial stressors are referred to as the allostatic load. And so I'd like to think of this just in more simpler terms. Again, you don't need these to know on this slide, these more complicated terms, but just as a general, we do have some self-regulating systems that are clicking on and off constantly to maintain our homeostasis. But if we get too big of an allostatic load, so if we have too much stress over a prolonged period of time, we start to see negative effects on our body. We see this a lot with individuals. Maybe they are in a stressful profession, or they've had a lot of stress in their life, and we start to see them having maybe coronary artery disease or high blood pressure. And so if you want to think of that as being the results of their allostatic load, that's a good example to use as we are sitting here describing physiologic homeostasis. As we continue on discussing regulatory mechanisms of the body, another system we want to think about is the local adaptation syndrome. And that is when your definition in your book is a localized response of the body to stress. And it usually only involves one body part, such as a tissue or organ, rather than the whole body. It's a very short-term adaptive response. And when this happens, the two most common localized stress responses we have is the reflex pain response and the inflammatory response. With our reflex pain response, basically it's a response of the central nervous system to pain. It's very rapid and automatic, and it serves to protect or to prevent injury. So a good example of this that comes to mind is if you're cooking, let's say you have maybe a pan of boiling water, but somehow you accidentally touch the pan with your hand, or maybe the boiling water touches your hand, and you immediately have that reflex pain response. Our hand immediately removes itself. It's trying to prevent any further injury, and it's kind of automatic. We don't really think about it. And then the next one, the inflammatory response, this is the local response to the injury or infection, and it serves to localize and prevent the spread of infection and promote wound healing. So, if you've just burnt your hand on a pan, you've had the reflex pain response, we immediately kind of get an inflammatory response from that. We may, at the site where we burnt ourselves, begin to have some pain, maybe some swelling and redness. It might feel warm to touch. And again, we kind of talked about this in the skin chapter. We're starting that stage of healing, and that is our inflammatory response. And that's how our body is reacting to maintain that homeostasis. So we've talked about our LAS, localized adaptation syndrome, and now we're moving on to the general adaptation syndrome, or what we can refer to as GAS. The GAS describes the body's general response to stress, a concept essential to all areas of nursing care, is what your book says. And within this general adaptation syndrome, or GAS, there are 3 stages. There is the alarm stage, the stage of resistance, and the stage of exhaustion. The alarm stage is initiated when a person perceives a specific stressor and various defense mechanisms are activated. And the perception of threat may be conscious or it can be unconscious. But basically, the sympathetic nervous system initiates what we have called the fight or flight response, preparing the body to either fight off the stressor or to run away. And we're not meaning that literally. But this phase, the alarm reaction, we also call it the shock phase, is characterized by an increase in energy levels, oxygen needs, um, cardiac output, blood pressure may be elevated, and we have real mental alertness at this point. And so your book gives a good description of this as a car accident or a car crash. Maybe you almost had a car crash. And in those initial moments when that's happening, you will think about it and you're like, yes, my heart rate went up, my blood pressure went up. I was totally mentally alert at that moment. Another example might be maybe if you've ever been mugged, or some of those, kind of traumatic, stressful triggers. Um, maybe right before an exam, you feel this shock phase, this fight or flight response. But within that phase itself, there is a counter shock phase. So right after that, you'll start to see the reversal of some of those body changes. So hopefully, right after the shock phase, you start to see your cardiac output and your blood pressure go down, and you're not needing as much oxygen intake at that point. The next stage is your stage of resistance. And your book describes this as having perceived the threat and mobilized its resources. The body now attempts to adapt to the stressor. Our vital signs, hormone levels, and inner projection return to normal in this stage. If we can manage the stress, if our body's mechanisms can manage it, if it's confined to a small area. So, the last that we just talked about. We talked about it being just like a localized response. I'm sure if you've burnt your hand before, you immediately had the fight or flight response. You're probably, you had that immediate pain. Your blood pressure might have shot up, your heart rate might have shot up, but our body was able to maintain our homeostasis, and those vital signs would come down after that. But if the stressor is prolonged or it's strong enough and it overwhelms the body's ability to defend itself, for instance, maybe we were in a severe car accident and we had severe injury and bleeding, the adaptive mechanisms may become exhausted. So that stage of resistance is what happens after that fight or flight. Are we able to go back to homeostasis afterwards, or is the stressor again too overwhelming, or been too prolonged, and we end up moving on to the stage of exhaustion? And within the stage of exhaustion, your book describes it, it results when the adaptive mechanisms can no longer provide defenses. We have a depletion of our resources, which results to the damage to the body in the form of just wear and tear on our body. So we can no longer defend ourselves against the stressor. If you think about maybe somebody who was in a car accident and they're bleeding, and if we don't get them help and they continue to bleed, their body can only take that stressor for so long. And either we get the bleeding stopped and we allow the body to rest and kind of mobilize its defenses and return to normal on its own. Or if we don't and that bleeding continues, that stressor continues, then our body will have total exhaustion and the patient will end up dying from that. So those are kind of your three stages in this GAS. It is one of the bullet points of the areas we wanted you to know. So there's the alarm reaction, which we think of as the fight or flight, the stage of resistance. Our body either is able to handle the stressor and it kind of returns back to normal, or if it can't, again, if it's too overwhelming or too prolonged, that stressor, then we advance to the stage of exhaustion. Psychological homeostasis. So this, your book gives the definition as to maintain mental well-being. A person needs to feel loved, a sense of belonging, to feel safe and secure, and to have self-esteem. When these needs are not met, the homeostatic measures in the form of coping or defense mechanisms help return the person to an emotional balance. Um, a person's response to psychological homeostasis and the degree of stress depends in part on the nature, the intensity, timing, number, and duration of stressors or those triggers. And when we have adaptation to stress, it also depends on a person's age, developmental level, past experience, their support system, and their coping mechanisms. Um, Within your book on page 1663, there's a little box, 42-3, and it just talks about source of stress with aging. And basically, it's saying stress with the resultant of anxiety is a risk in the older population. And as the number of older adults increase in the population, anxiety is now and increasing will be a significant problem. Um, Not all older adults will experience stress to the point of anxiety, but anxiety should be kept in mind as a possible nursing diagnosis when we're providing nursing care. And again, there's a lot of things as we start to age and our developmental level and how we can cope with that. We start to see a lot of health problems. So, with increase in health related procedures maybe needing to take place or diagnosis, maybe starting to have some chronic illness. We're declining physically and mentally in our capabilities. Maybe we have to begin to start to have the loss of a spouse or a significant other. Maybe we start to see an increase in our social isolation. And so this book gives these examples, or this little box here gives these examples. And it's a good way to realize that, if we don't have some good coping mechanisms, that we won't have that emotional balance in our lives. And that as we get older, there are things that are going to affect that emotional balance, and we may not be able to have it as easily. As I said, our defense mechanisms may decrease. And in the next slide, we're going to kind of talk about the mind body interaction. But, as we think about this psychological homeostasis, our adaptive responses to that, we're going to talk about in the next few slides. They're going to be including our mind-body interaction, the ability to handle anxiety, and then our coping and defense mechanisms that we have. This slide is talking about the mind-body interaction and the relationship that the psychological stressor or trigger in our lives and how it can cause a physiologic stress response. Your book gives a really good example in the reading, and it talks about imagine yourself as, and I hope this isn't you as a student, but imagine yourself, you're scheduled to take a final examination and you must earn a passing score to pass the course and remain in the nursing program. After being awake most of the night, you cannot swallow any food at breakfast. You cannot, or you have a rapid heartbeat and you're filled with feelings of apprehension and you're having some diarrhea. And that is the example from the textbook it gave. But I think what we want to indicate with this slide is you can have what is called psychosomatic illnesses that are related really to stress. So you might see these physiological indicators of stress. You might begin to have diarrhea or a headache, or notice that your vital signs are extremely high. Maybe you're having some nausea. As a nurse, I worked several years in an elementary school as a school nurse, and I would see this a lot with kids. They would come to the nurse's office and they'd complain of a stomach ache, and they seemed absolutely fine. Sometimes they were laying there smiling, usually didn't have a fever, couldn't really tell that anything was wrong with them. And if you spend enough time talking to them and trying to just figure out what's going on with your day, you'd usually come, and this isn't for every kid that came in with a stomach ache, but, after some investigation, the ones that were actually stressed, there was usually a test in class or some project they didn't want to work on. Maybe they didn't want to go to recess because somebody was always being mean to them. So there is a relationship between that psychological stress and the symptoms that it may come out as. And so that's just to be aware of. And you're taking care of a patient. You want to ask those questions about stressors in their life, because you could see that it is causing them to have a lot of nausea or upset stomach. Maybe it's causing them to have some weight loss. So just to be aware of that mind-body interaction. Anxiety. This is our most common human response to stress when we think about our psychological adaptation mechanisms. And anxiety is just a vague, uneasy feeling of discomfort or dread. Um, Often it's from an unknown source. And we have these feelings of apprehension, and that can be caused by just anticipating some type of danger. Um, and anxiety, it's really just a sign that alerts us to maybe a impending danger. And your book talks about anxiety, and it differentiates that from fear. Fear, in contrast, is really just a feeling of dread in the response to a known threat, where anxiety, we're just having that uneasy feeling because we are perceiving that there's a possible danger. And the book talks about 4 levels of anxiety. And the first 2 that are on this slide, it talks about mild, just present in day to day living. Usually it doesn't really affect us too much. It motivates us growth wise. It facilitates our problem solving when we have some mild anxiety. And then there's moderate, which can cause focus on immediate concern. We might see with moderate anxiety that we will have some slight increase in respiratory rate or pulse. Um, it may manifest itself by a quivering voice, maybe some tremors. We might even see some muscle tension when are experiencing moderate anxiety. So we just talked about mild and moderate anxiety. Your book continues to go on and discuss severe anxiety. And with severe anxiety, you have or it creates a very narrow focus on specific details, and causes the patients, all their behaviors to be geared towards getting relief from that anxiety. You may even see this person trying to avoid situations that they know will cause the anxiety, but it can be characterized in this stage of severe by extreme fear of a danger that is not real. And so, with that being said, and we've said they have a very narrow focus at this stage, the person will have some impaired learning ability. They'll be easily distracted. And so, if you are having a patient that has a severe anxiety, this is probably not the best time to try to do any teaching with the patient, any education with the patient, because they can't focus on what you're really trying to say to them or what you want them to learn. So just being aware of your patient's condition is important in the stages of teaching a patient, and of trying to explain something to them, because they are not able to focus at this point. And then your book talks about panic, which differs from severe anxiety, although the two seem very similar. But with panic, it causes the person to lose control and experience dread and terror. This results in usually disorganized states and is characterized by an increased physical activity, distorted perceptions of events, and loss of rational thought. Sometimes panic is manifested by difficulty communicating verbally. The patient might seem agitated or trembling. They may even have some poor motor control or some sensory changes. You might notice them having sweating, tachycardia, hyperventilation, maybe some shortness of breath, maybe chest pain or pressure. That's why sometimes panic attacks can appear like a heart attack when they're, really not. But again, the same as the severe stage, the panic stage, the person is unable to learn or concentrate. They can only focus on the present situation, and they are experiencing feelings of this impending doom. And, if this level were to carry on, as your book talks about, it can lead to that exhaustion and death. When we were talking earlier about fight or flight response, the resistance stage, and then we went on and talked about the exhaustion stage. So this is where we want to help our patients who have issues with panic attacks because it can deplete their resources. Um, so when we're thinking about the stages of anxiety, again, mild to moderate, we can still talk to that patient. As far as educational needs and trying to communicate with them. But when they go into that severe panic level, it's going to be hard to do any kind of discussion with them because they are not able to really learn or concentrate at that point. And they are trying to get immediate relief from these feelings of impending doom and from these symptoms. And so, as a nurse, we're going to have to work towards kind of treating the symptoms at that point. Anxiety is often managed with conscious thought or coping mechanisms, which are behaviors we use to decrease our stress and anxiety. Typical coping behaviors that we see in patients or we may use ourselves are listed here. They include crying, laughing, maybe sleeping, cursing, um, and the list goes on. What we need to realize is some of our coping mechanisms can be very healthy while other ones can be very unhealthy. So, if we choose to use physical activity and exercise every time we're stressed, that's probably a healthy thing to incorporate with our coping mechanisms. But, we have people who may handle their stress by smoking. And so that's not the best coping mechanism. Your book continues to talk about task-oriented reactions. And basically, it says with moderate, severe, and panic levels of anxiety, there are greater threats involved, and it takes more complex coping mechanisms. And task oriented reactions are kind of what we use with those. Task oriented reactions involve consciously thinking about the stress situation and then acting to solve problems, resolve conflicts, or satisfy the needs. And these reactions within the task oriented reactions include attack behavior, withdrawal behavior, and compromise behavior. Attack behavior occurs when a person attempts to overcome obstacles to satisfy a need. And it can be constructive with assertive problem solving, or it can be destructive with feeling and actions of aggression and hostility. The withdrawal behavior involves physically withdrawing from the threat or emotional reaction, such as admitting defeat, um, maybe feeling guilty, becoming isolated. And then those compromise behaviors are usually constructive. They often involve the substitution of goals or negotiation to partially fulfill the needs. So, really, when we think about that, anywhere from moderate to panic, anxiety level patient, we want them using compromising behaviors. Attack behaviors may be good if they are using assertive problem solving skills, but it also can be a negative coping skill if they're being very destructive or acting very aggressively or hostile or showing hostility. And the withdrawal behavior, obviously, it's not healthy to withdraw from situations, become isolated. So, again, these are just examples of different coping mechanisms you may see with somebody who is having anxiety. And to take away that we do have both healthy and unhealthy coping mechanisms. Defense mechanisms are reactions to stressors that are unconscious. These mechanisms protect a person's self esteem, and they're useful with mild to moderate anxiety. Um, your book has a great table, 42 2. It's on page 1666, and it gives commonly occurring defense mechanisms, and it gives some really great examples with it. For instance, compensation, it gives the cause. It's a person's attempt to overcome a perceived weakness by emphasizing a more desirable trait or overachieving in a more comfortable area. And then gives you an example. A student who has difficulty with academics may excel in sports. Denial. You will see a denial. I feel like that's one that really shows an impatience sometimes. It's basically a person that refuses to acknowledge the presence of a condition that is disturbing. So it gives an example. Despite finding a lump in a breast, a woman does not seek medical treatment. That would be an example of denial, of not wanting to acknowledge that there's anything wrong. And the book goes on. It talks about displacement, and it gives an employee who is angry with a coworker kicks a chair. So basically, they get angry and they take their anger out on an object. Introjection. A person incorporates qualities of values of another person into his or her own ego structure. And it gives an example. An older sibling tells his preschool sister not to talk to strangers, expressing his parents' values to his younger sister. So that was with introjection. So it goes on. Regression's another one you might see. A person returns to an earlier method of behaving. You'll see this a lot with kids. Children often regress. You may have a child who's potty trained and suddenly they are having accidents. And it's just a defense mechanism for something going on in their life. Rationalization, a person tries to give a logical or socially acceptable explanation for the questionable behavior they're having. A patient who forgot to keep a healthcare appointment says if patients didn't have to wait 3 months to get an appointment, they wouldn't forget them. So that's a good example of rationalization. But I would refer to your book, Table 42-2, and understand these different defense mechanisms. It does give you a good what causes them and examples to make sense of them. But they are ones, I guess you would say, unconscious reaction or way to protect one person's self-esteem that we often see or maybe even use ourselves in situations. So, stress and health and illness. Your books talks about, stress in a healthy person can promote health, and it maybe even can prevent illness. So, not all stress is bad. For example, fear of developing, it gives an example, fear of developing lung cancer may motivate a person to stop smoking. So, again, stress in healthy people can promote, better health. But when what we see is the effects of stress on a sick or injured person, in contrast, is usually negative. Stress can make illness worse, and illness can cause stress to be worse. Your book, again, I refer back to it because it does have a lot of great tables and boxes, but it has a box 42 5, and it is on page 1667. And it pretty much talks about the effects of stress on basic human needs. If we have not said this before, one of the things you want to take away from this course, and you will want to know really well throughout the nursing program, is Maslow's hierarchy of needs. And basically, we're talking about physiologic needs, safety and security, love and belonging, self-esteem, and self-actualization. And so you want to know what goes into these and how you prioritize based on Maslow's. But this box in particular talks about the effects of stress on the basic human needs. So we kind of mentioned this earlier. When we have stress, we might see on the body a change in appetite, activity, or sleep, or elimination patterns, or a change in our vital signs. when it comes to maybe stress is having an effect on our safety and security, and this makes us feel threatened or nervous, we might begin to start using ineffective coping mechanisms or even be a little bit inattentive. As far as love and belonging, stress can cause us to become withdrawn or isolated. We might blame others for our own faults. And we might start to demonstrate some of that aggressive behavior. Self esteem, we might exhibit somebody having attention seeking behaviors because of how stress is affecting them, or they might become workaholics. And then self actualization, as far as stress is concerned, they might refuse to accept their reality. And they may only, maybe they're only centering on their own problems. And they might even demonstrate some lack of control in their life. And so just being aware of what is Maslow's hierarchy of needs, knowing, the order of these, how you prioritize these, and then understanding the effects that stress can play in each of these categories would be very important, especially as far as understanding patient care and where you start. What do you start working on first to help this patient with their stress? So I feel like your book kind of repeats itself in certain places. It moves on through and talks about long term stress, and we kind of talked about this um, again when we were talking about the gas adaptation syndrome and the fight or flight response, and we talked about the resistance stage. And if we're not, we have a prolonged stressor. Eventually, we can't, our bodies can't deal with that. And so then your book has moved on and it's talking about long-term stress. And basically, long-term stress, it tends to pose a serious threat to physical or emotional health. As the duration or intensity or number of stressors increase, a person's ability to adapt is lessened. And then the failure of adaptive mechanisms is also influenced by a person's state of health and their past experience with stress, which we've said. So, anybody that's having long term stress, as we said, they're going to have compromises in recovery and returning to normal function. They're going to have increased risk for diseases or injury. And there are, long term stress is associated with specific diseases. And I think there was a box earlier in the chapter. It talked about those disease states. And I mentioned a few of them having hypertension or high blood pressure and coronary artery disease. So, again, I'm sorry the book repeats itself. We did kind of already talk about this, but just being aware how long term stress can affect somebody's physical status is again very important as far as trying to educate your patients. If we're aware they have high blood pressure and they've admitted that they have this stress that has been over this long period of time, then we've got to work with that patient on different coping mechanisms so that we can improve that patient's health. Family stress, it's important to talk about because stress that affects an ill person, it is also going to affect that person's family member or significant other. And oftentimes, the family and the individual, they often use many of the same coping or defense mechanisms to cope with the stress. Your book talks about sometimes family members can be overly protective or maybe deny the seriousness of the illness. They have that denial going on, or they might blame healthcare providers for the patient's condition or behaviors. But then on the other hand, the family is our best tool with our patients because they can provide the support and the social support necessary to help the patients manage and adapt to the stress. So, with family stress, they are going to feel a loss of control over their normal routines. There might even be concern for, future financial stability. If you have a family and maybe mom is a stay-at-home mom and dad is, the one who brings in all the income, and now dad is really sick and ill, there can be some concerns about their financial stability, and that can cause stress in their lives. They may have feelings of anger or feelings of helplessness and guilt, and sometimes that comes out as they do blame the nurse, or they get mad at the healthcare staff because they're expressing that stress and with those defense mechanisms. Um, the one thing with families and the denial, I've seen that often, like maybe a loved one is giving some really bad news, like they've got this terminal cancer and there's nothing really they can do for them. But sometimes I've seen, the spouse being very hopeful and wanting, all measures taken for their patient or for their loved one. And that's again kind of an example of that coping or defense mechanism where they're kind of in denial about the seriousness of the illness. So just being aware of how stress that it doesn't always just affect your patient, but you're also going to see that that family stress is going to play a factor in the care that you give patients. All right, let's talk about crisis. So again, I think I said this earlier in the PowerPoint. This chapter has a lot of terminology in it. And it describes crisis as is a disturbance caused by a precipitating event, such as a perceived loss, a threat of loss, or a challenge that is perceived as a threat to self. So a crisis can be three different things. It may be a maturational, which is something that occurs during developmental events that requires a role change. So you might see it from, gosh, I have teenagers in the house, so I kind of saw this, occasionally from going from the tween years into the teenage years. You might see it from the teenagers to the adults. And then it talks about situational. So a crisis could be situational. It occurs when a life event disrupts a person's psychological equilibrium. So a job loss or a death of a family member can really send somebody into a situational crisis. And then adventitious, accidental or unexpected events resulting in multiple losses and major environmental changes. If your home burns down, that unexpected event can cause you to have a crisis. And in a crisis, a person's usual methods of coping are just ineffective. This failure produces high levels of anxiety and disorganized behavior and the inability to function adequately. And oftentimes, um, within a crisis, um, it will is associated with anxiety. Initially activates the person's usual methods of coping, but these are not effective, and the person starts to experience more anxiety because the coping mechanisms are not working. And as the crisis continues, the person tries new methods of coping or redefines the threat, is what your book says about this. So, when you're going into a crisis level, we kind of talked about those levels of anxiety. So, as a crisis starts, that patient may be in that mild to moderate anxiety level, but when their coping mechanisms aren't working, they become or they go into more of that severe panic level anxiety, and they are not able to function well in that role. So just understanding what a crisis is and the terminology and the different types of crisis is really what I want you to take away from this slide. So as we continue on, still talking about stress, there are factors that affect stress and how a person is able to adapt. And your book talks about it kind of can depend on the source of the stress. So you could have developmental stress, and it occurs as a person progresses through the normal stages of growth and development. And it gives in your textbook, it gives examples of stages of growth and development associated with developmental stress. And it talks about, an infant learning to trust others and a toddler learning to control elimination. And it goes through those different stages. The last one, it talks about the older adult reflecting on the past life experiences with satisfaction. So those are some examples of stages of growth that you might see with developmental. But the other one is situational stress and just understanding the difference. So, developmental, you will see it as you go through normal stages of growth and development. But situational, it can concur at any time. It's unpredictable, and it can be positive or negative. And again, it can be influenced by a person's developmental level. We know that younger people, children are, don't have the ability to adapt as well to stress as an adult would. So it does give you some examples, and we've kind of talked about this throughout, again, the PowerPoint. The book's kind of repeating itself here. But situational stress, we talked about illness and injury. Maybe a person has just gone through a divorce, a loss of a loved one or family member. Maybe they have a new job or their role has changed in some way. So we've kind of hit on those situational stress as we've talked about stress in this chapter. But there are personal factors that will play a part in how we are able to adapt. And your book talks about a person's physiologic reserve and genetic inheritance are important to maintaining that homeostasis in their ability to adapt. So we've kind of talked about this in other chapters. Like, we have to have adequate nutrition and sleep in order to have a good immune system and to, have wound healing in our bodies. So, and to have energy production. If we have malnutrition, or some kind of dietary deficit, or or we have a sleep deprived patient, then that is going to affect that person's ability to adapt to stress. They're not going to have the immune system. They're going to get sicker. Their reserves are going to depleted. So those personal factors with that play a part. Social factors. Again, we've kind of talked about this throughout. People who have a strong support system and relationships are better able to adapt to stress and remain healthy. So, I feel like we're repeating ourselves a bit throughout the chapter, but just being aware that there are factors that will affect the adaptation somebody can have to stress. And there are two sources, again, there's developmental stress and situational stress, and our personal factors or how well we are going to adapt to those two types of stresses. So we've talked a lot about patient stress or, caring for somebody that has anxiety and stress. And your book kind of turns and then begins to talk about stress and adaptation in nursing, which is great because often nurses are involved in activities in interpersonal relationships that are often very stressful. And this slide is really about some of the activities or situations that are identified as highly stressful in the medical field. The first one is assuming responsibilities for which you are not prepared. I feel like, especially with new grads, you go through nursing school and, you get out and, you start and you're going through orientation and they give you maybe 5 patients, but you're with another nurse. And then when you're out on your own, you may feel this way. You may feel like, oh my gosh, I have these 5 patients by myself, and maybe one of them or a few of them are really sick or they're high acuity as far as the care they need. And you may feel that stress because you feel like you're not prepared maybe in that way. You may feel stress when you feel like you're working with unqualified personnel, or working in an environment in which the supervisors are not supportive. If the managers are not supportive or the nurses are backing the nurses, that can make a very stressful environment for all the employees. Caring for patients in cardiac arrest or dying persons. Some people thrive in that critical care emergency room. Um, you know, they love that, but that may not be for everybody. And if it becomes where it's a set stressful situation and you don't even want to come to work because you have to care for this type of patient, it might be time to look at that stress level. Maybe that's not your type of nursing that you want to be in. And then nurses also, we have a lot of stress when we have to experience conflict with peers, and that is going to have to happen or will happen at some point in somebody's nursing career. But um, learning to deal with that and adaptation is super important. Student nurses, all of you guys listening to this PowerPoint, you know, your stress comes from fear of failing a course. As you get towards the end of the program, you have a lot of fear of failing NCLEX and the demands of the nursing program. I'm sure many of you dreamed. I mean, this is what you've wanted to do all your life, and then you're here and you didn't realize the demands of nursing school, of how much you would not have as far as free time, because it is a demanding program. Um, I've had students, there's always a student or two every semester that are afraid of injuring their patients in some way. And, there's a lot of stress around the need to balance work and study and meeting that financial and family responsibility. So, just being aware, these are some of the most stressful situations for nurses and for students. And, if we don't come up with appropriate coping mechanisms to deal with these, we worry about nurses or students having burnout. And your book kind of defines burnout. Um, and it's kind of compared, or it says it can be compared with exhaustion stage of anxiety and is characterized by a wide range of behaviors. You know, we've probably all heard of burnout before, where we just can't take it anymore. And what worries me is when somebody does eventually have burnout, a couple of things happen. They either stop caring and do the bare minimum of their job, or they usually leave the profession. And we don't want that. We need nurses. So it's important to learn some coping, behaviors and take care of ourselves. Give ourselves some time so that we don't allow stress to cause us to have burnout. So this slide talks about lateral violence, and I'm, scanning through your chapter, and I'm not sure, we had a recent update to, and we have a new edition of the textbook, and I'm not sure it talks about lateral violence, but it's important to talk about it here. So lateral violence includes verbal, emotional, or physical abusive behavior of an LPN or RN toward another staff member. And what this means is, if you're exhibiting aggressive behavior and civility, you're shouting at another healthcare worker, or you're failing to help another coworker, um, or you're having violent acts against health or in other episodes of workplace violence, it is shown that it's increased profoundly, um, influencing nurses' feeling of safety and control of their environment. You know, we all need to be professional. Nobody should be yelling at somebody else. If you know, I've been a nurse for over 20 years, and back in the day, I was a new grad. This was 20 plus years ago, and it was okay in that time for physicians to yell at nurses. Nothing was ever done. I can remember calling physicians for orders and having them yell at me and hang up. And that is really what is considered nowadays lateral violence. And it's really not tolerated anymore. And so if you are in a situation where, you're being yelled at by another nurse, another healthcare worker, a physician, it really needs to be reported, maybe to your charge nurse that day, and to your nurse manager, because that behavior needs to be stopped. It is unacceptable. And at the same time, you want to make sure you aren't allowing your stress level to get to the point where you're shouting at another healthcare worker, because that is lateral violence, and no one deserves that aggressive behavior or that incivility. And we need to learn to communicate in a professional manner and not allow stress to affect that communication. So, what to do if you're experiencing stress? Having a self awareness is essential when caring for patients. You have to know yourself and your stress level. Often, I have seen, nurses, and you will have this too in your career. You will encounter a patient who is, maybe they're rude, maybe they're difficult, they're uncooperative, and it will take its toll over a 12-hour shift. And I've seen nurses too often who become stressed, and they often get short with their patients. That nurse client or that nurse patient helping relationship, it kind of goes down the drain. If you're being short with the patient, they're not going to trust you, they're not going to work with you, and it's like this continuous cycle. So, just being aware of our own stress levels can help us better care for our patients. Knowing when we're stressed, knowing do we have realistic expectations or perceptions. Your book, and this is mislabeled. I'm sorry, this PowerPoint does need some updating, but it has a promoting health, and it should be 42-1, and it's on stress and adaptation, and it is on page 1673 of your book. But it talks about how nurses must also examine their own feeling or their own level of stress, and nurses must demonstrate behaviors that support a healthy lifestyle. So it's kind of got an assessment checklist with it, um, and it asks you, do you almost always, sometimes, or almost never, do you have a realistic perception of new situations, self and others? And it kind of goes down, and depending on how you answer, you kind of need to implement some self-care behaviors based on that. So, and the PowerPoint says here, use the assessment to determine how well you are at adapting to stress. Then to develop a prescription for self-care by choosing the appropriate behaviors. Um, and so some of them are, like the first one where it talks about self-care behaviors in this box, it, which is in the textbook. It says to accept as positive indicators of growth the changes that come with different parts and stages of life. Maintain an open mind with change. Change what you can and accept what you cannot change. So, you know, just being aware of these, you will probably, need to reflect on these and use these throughout the nursing program, even before you become a nurse. But just being able to understand um, what affects us, how do we become stressed, having a self-awareness of our stress, we will be able, in implementing some of these self-care behaviors, we will be able to, better care for our patients, and be more kind and be more patient with our patients. So this slide is just a continuation of what I was talking about. Again, it's from the Promoting Health 42-1 that I just talked about on the previous slide on page 1673. And these were the self-care behaviors that I was starting to read to you. I think I read you the first two, but it gives you at least 10 here. And so, you know, just implementing, again, I cannot stress this enough, implementing this even in, the nursing program, being aware of your stress level and just doing self-care behaviors, it'll make you a better student. So I just wanted to let you know that this is what this slide is referring to. If you didn't want to go into the textbook and look, you could look here on this slide. So this slide is referring to healthy behaviors that we can, do to reduce stress. And most of these, I feel like, are probably common sense. You've heard of them, you're aware of them. Um, Exercising is a great way to reduce stress, getting enough rest and sleep, and then just proper nutrition, eating healthy. And, we can teach these to our patients. We can teach these in order to help our patients decrease their stress at home. And even in the hospital, you might have a patient who seems really, I actually had this happen to a student last semester. They got from the night shift a report, and they said the patient was cranky and yelling at them. And then the student went in, and again, you can't always, you have to have your own perceptions of your patient, and went in to greet this patient and just really started talking to the patient. How was her night? And come to find out, this patient, had gotten no sleep. It was extremely exhausted. And just throughout the day, while the student had that patient, she promoted her getting some rest and sleep. And that patient was very pleasant and very cooperative. So just realizing that, those factors, really impact how we behave and how we adapt to our situations. And so teaching that with our patient and advocating for those things are super important in helping our patients reduce their stress level. This slide is just a continuation of techniques that can be used as far as stress management. These are on in your chapter, pages 1676. It looks like to 1677. And, relaxation. You think about relaxation techniques. Your book gives an example, like in childbirth, like we teach rhythmic breathing. But relaxation can be as much as dimming the lights, maybe providing a warm blanket to the patient, providing more of a calm atmosphere, can really reduce stress. Some of these other as far as relaxation, meditation, we're going to get to more in your complementary health and comfort and pain management chapters. So I hate to spend too long talking on these, but these are beneficial. I know, like when I worked years and years of pediatrics, when we were doing some procedure to a patient, or a child, maybe it was starting an IV, I use guided imagery a lot because really, if I could get the child to kind of talk about their favorite place they like to go in the summer or what they like to do at the park and creating that imagery, it kind of calmed them down. It didn't have them thinking about what we were doing or the stressful situation that they were in. So these are beneficial at relaxing your patient and reducing their stress levels, and just being aware of these when you go into healthcare and taking care of patients. And you may use some more than others. Again, the relaxation guided imagery, those are some that you may use more than meditation. But making that available to your patients or suggesting that or trying that with your patient can be very beneficial, especially in the acute care setting. So this last slide is just about crisis intervention, and I feel like your textbook has just a weird layout because I felt like it was slides ago when we were talking about crisis intervention, or that we were talking about what a crisis was, and now we're talking about the interventions for a crisis. These can be found in your textbook, and they are on page 1677. It has a section that talks about providing crisis intervention. If your patient is in a crisis situation, it usually results that the person cannot function normally and requires interventions to regain their equilibrium. And it talks about these 5 steps. The first is to identify the problem. And then the second one is to list alternatives, choose from among the alternatives, implement the plan, and evaluate the outcome. And so when we talk about identifying the problem, I'm just kind of reading through the textbook here. It says this may be more difficult than it appears, as the cause of the crisis is often difficult for the person to identify accurately. Until it's clear, a solution is impossible. So this is, if the patient is, again, we go back and they're in a crisis, they are at that severe to panic level anxiety, and it's very hard for them to focus, you know, at the moment. And so now we're asking them to try to work on identifying the problem, and that can be really difficult for these kind of patients. The second step talks about list of alternatives. All possible solutions for the problem need to be listed. An appropriate solution to a problem is much more likely if many options are considered. And this is so true. I think of it as brainstorming. So, if you have multiple options listed for the patient, they have some go to as far as trying to get resolution with this problem. Helping them choose from among the alternatives. Each option needs to be carefully considered using what happens if approach. Implement the plan. The alternative chosen is put into action, and the nurse may need to provide support and encouragement. And then evaluate the outcome. And then she talks about, in the final steps, the effectiveness of the plan needs to be carefully considered. Is it working for the patient? You know, I don't know that this is what the story that comes to mind when I think about crisis intervention. And, it's not nearly as severe, but my oldest daughter was having just tons and tons of anxiety. It was about the time we were applying to colleges, and she didn't know if she got accepted anywhere, and her schedule at school, and her friends, there was drama there, and she was very just distraught, having a hard time. And we did go to her physician to talk through, because I didn't know if maybe she needs some counseling, some anti-anxiety medication. Not sure where to go with her. And we kind of, just talking to her doctor, she was able to kind of identify the problem. And some of her anxiety was just how she thinks of herself and how she talks to herself, her self-talk or her thoughts. And so what the doctor suggested was, list some alternatives. Like, she wanted her to start keeping a diary of, when she has thinks of the bad thoughts, to, think of the good thoughts and write those things down, and to read those lists every day, so that, she could learn to calm her anxiety by learning to talk to herself in a different manner. And it has worked. Her anxiety's calmed down a lot. And I know she wasn't in the crisis mode yet, but I kind of think of that when I think of this 5-step problem solving technique. You have to be able to identify the problem. You go kind of list what you're going to do differently. And you kind of have to do that ahead of time. If you can, not when you're in the crisis moment, but if you're in the crisis moment, you have to list alternatives and say, what happens if I do this? When you're choosing your alternative to deal with that problem. Implementing, and then of course evaluating is always, did we solve this crisis? We always want to encourage the patient to accept what cannot be changed, and change what cannot be accepted. And we always want to emphasize accepting help from others for patients. And the biggest thing with your when dealing with crisis intervention is just making sure you are using therapeutic communication skills in your interactions. This is the end of the PowerPoint. And again, we've had a long discussion over stress and adaptation. We've went over a lot of terminology, and hopefully after listening to this voiceover PowerPoint, you're not feeling too stressed. And I hope this helps you study for your exams. Thanks.